Did you know doctors can often spot hidden health issues in seniors just by looking at personal hygiene? What seems like a harmless habit, like skipping a shower or ignoring your nails, could actually be your body's way of warning you about something more serious. The truth is, most older adults don't realize that small hygiene mistakes can act as red flags for doctors, revealing conditions like heart disease, diabetes, or even dementia. And here's the scary part. These signals are often ignored until it's too late. That's why today, we're uncovering 7 personal hygiene mistakes doctors immediately notice in their elderly patients. Some of these might sound simple, but number 4 is so surprising that it shocks even experienced caregivers. More importantly, I'll show you what you can do instead. Easy changes that could add years to your life and keep you independent for longer. Let me start with a story. I once spoke with Arthur, a 74-year-old who thought his daily habits were fine. He was active, went on walks, and even helped coach his grandson's baseball team. But during a regular checkup, his doctor noticed subtle hygiene issues that Arthur thought were nothing. It turned out these little habits were hiding signs of a condition he'd been developing for months. I had no idea, Arthur admitted. If my doctor hadn't spotted it, I might never have known until it was too late. That's why paying attention to these details matters so much. One of the most overlooked problems is oral hygiene. Many seniors believe brushing quickly once a day is enough, or they assume bleeding gums are just part of aging. But dentists and geriatric specialists have shown that gum infections can actually leak bacteria into the bloodstream, damaging the heart and even raising dementia risk. In fact, studies show seniors with untreated gum disease are up to 3 times more likely to develop cardiovascular issues. I met a woman named Helen, 70, who thought her sore gums were just part of getting older. But during a dental exam, her dentist discovered an infection that was already affecting her circulation. The bacteria from her gums had traveled to her heart, creating dangerous inflammation. With treatment, she avoided major damage, but it was a wake-up call. The takeaway? Replace your toothbrush every 3 months. Brush at least twice daily for 2 full minutes and floss nightly. If you notice bleeding or swelling, don't wait. Those are warning signals your body is sending you. Another big issue is reduced bathing. As people age, some cut back on showers or baths, either because of mobility challenges, fear of falling, or simply not feeling dirty. But your skin is your largest organ, and skipping proper care can hide early signs of deeper problems. Doctors at leading clinics say skin discoloration or changes in texture often point to conditions like diabetes, liver disease, or circulation issues. Take John, a 76-year-old, who thought bathing once a week was enough. During a routine exam, his doctor noticed unusual patches on his skin that John hadn't seen clearly. Further testing revealed the beginnings of kidney disease. If caught later, his outcome could have been far worse. Regular bathing at least 3 times a week, with mild soap and proper moisturizing, doesn't just keep you clean, it gives you a chance to monitor your skin for changes that could save your life. Nail care is another hygiene detail many seniors overlook, but doctors don't. Fingernails and toenails can reveal everything from circulation issues to immune system weakness. Thickened, brittle, or discolored nails aren't just cosmetic problems. Research shows nail abnormalities in older adults led to the discovery of hidden medical conditions in nearly 1/3 of cases. For example, Margaret, 81, thought her yellow toenails were just a harmless part of aging. She avoided open-toe shoes but never sought help. When her podiatrist finally examined her, the changes pointed to an infection tied to suppressed immunity. Further tests revealed an underlying health condition that required immediate treatment. The lesson here: trim your nails regularly, keep them clean and dry, and never ignore sudden changes in color or thickness. Now let's talk about something most people are embarrassed to discuss: bladder control. More than half of seniors deal with incontinence, but many try to hide it. The problem is, untreated leakage can cause skin infections, dangerous falls, and sometimes reveal conditions like prostate or bladder disease. I'll share the story of Daniel, a 72-year-old who quietly used tissues and spare clothes instead of talking to his doctor. By the time he sought help, he had painful sores and was diagnosed with a prostate issue that could have been treated much earlier. His words still stick with me. "I thought hiding it was saving me dignity, but in the end, it almost cost me my health." If you notice even occasional leakage, don't ignore it. Talk to your doctor. Solutions exist, and proper products can help manage it safely while protecting your skin. Ears are another overlooked area. Many seniors still use cotton swabs, believing they're cleaning their ears properly. But inserting anything into the ear canal can push wax deeper, cause injury, or even puncture the eardrum. Ear specialists say a large percentage of preventable ear infections in older patients are due to improper cleaning. Take Laura, 69, who cleaned her ears daily with cotton swabs. One slip caused a tear in her ear canal that led to a painful infection and partial hearing loss. "I had no idea I was making it worse," she said. The correct approach: clean only the outer ear gently with a warm cloth. If you feel fullness, discomfort, or reduced hearing, see a doctor for safe wax removal. Never try to fix it yourself with sharp or small objects. Foot hygiene is another area where doctors look first. Feet can reveal circulation problems, nerve damage, or diabetes, often before other symptoms appear. Daily foot care and inspection can prevent up to 85% of diabetes-related amputations. That's a staggering number. Consider Frank, 75, who ignored dryness and small cuts on his feet. He thought they were just normal aging signs. But during a checkup, his doctor noticed and ordered further tests. The result? Early-stage diabetes, caught before it caused irreversible damage. Washing and drying your feet daily, wearing clean socks, moisturizing but not between the toes, and checking for cuts or color changes can literally save your limbs. Finally, medication side effects often show up as hygiene changes before more obvious symptoms appear. Dry mouth, unusual body odor, or excessive sweating can signal dangerous drug reactions or organ stress. Carla, a 68-year-old, was taking several medications when her family noticed she had developed a strange odor. She bathed regularly, but nothing helped. Her doctor realized it wasn't hygiene. It was her medication affecting her liver. Adjusting her prescription prevented serious complications. The lesson here? Pay attention to changes that appear after starting new medications. Keep a simple journal of hygiene changes and always report them to your doctor. Never assume it's just aging. Now you know the 7 hygiene mistakes that doctors notice right away in elderly patients. Each one may seem minor, but together they can reveal serious health problems, and correcting them could extend your life, protect your independence, and help you feel stronger every day. So here's my question for you. Have you or a loved one ever had a doctor point out a hygiene issue that turned out to be more serious? Share your story in the comments. I'll be reading and replying. And if you found this valuable, don't forget to subscribe, hit the notification bell, and share this video with friends and family over 60. This information could literally save a life.